Today I'd like to talk with you about medial epicondylitis, or also referred to as golfer's elbow, because of the action of wrist flexion. So just bending that wrist towards your forearm. It happens, your pain happens on the inside of the elbow, just a couple finger widths down, and it travels down into that muscle. It's really that tendon that becomes inflamed from that repetition of wrist flexion. So it can happen because of tennis, it can happen because of pickleball, and of course, swinging a golf club. And it's just that improper use. Instead of keeping that wrist nice and straight, we end up flexing that wrist. The reason why we refer to this as golfer's elbow is when someone swings. So instead of doing a side shot, I'm going to do a front shot here so you can watch this forearm. When I lift up, I draw back, and I go to swing through and I flex that wrist. So we should not flex that wrist. So whenever I draw back and go to swing through, I come down and I flex this wrist. This wrist should stay straight throughout that motion. So by flexing it, we put a lot of pressure on the inside of that elbow. So we want to avoid doing this because that inflames these tendons and causes us pain. So home things to do to treat this whenever you think that you may have it. A test that I do is if you make a fist, you curl up that wrist, and then you try to push down on it with your other hand, you'll get severe pain, sometimes that shooting, numbness, and tingling. And if you're a golfer or if you've done any of those other activities, even like pulling weeds, if you flex that arm, that can lead to that tennis elbow. So some things that you can do to self-treat at home are ice. If you also have a partner, you can do a massage. I can't quite do that massage with just like my thumb or with my fingers, but if you go side to side, have someone do that transverse friction massage. It's just a fancy term for massaging in the different directions. It increases the circulation, and then you can ice that up. So I like to just freeze a styrofoam cup, and you can peel that cup down and you can ice on that area. 5 to 10 minutes is perfect. And especially if you have been active that day, or if you have played golf, something like that, it would be great to ice after. But you should ice daily until you get rid of the symptoms. In addition, you can take ibuprofen, any anti-inflammatories. They also have a brace that you can use for that medial epicondylitis. So as for tennis elbow, they make a nice little brace that just goes a couple finger widths down, puts pressure on that tendon so that if you are out golfing or you are performing one of those activities, that it relieves that pain and it relieves that pressure. Some other things that you can do, obviously, are stretching. So some physical therapy things that I like to encourage. And also, chiropractic care is great because sometimes you get a little tweak in that elbow that needs fixed, in addition to physical therapy. So we have anti-inflammatories such as an iontophoresis or a phonophoresis, which puts some medication, some anti-inflammatory medication down into that area to reduce your inflammation, which is extremely important. But for stretching wise, you would want to open that arm up and extend. Stretching, I always recommend anywhere from 30 to 60 seconds is a good stretch. 3 of those for those wrist flexors, and then also the wrist extensors, because you just want to go both directions with that. And then some strengthening activities. So you would perform just a slight elbow bend. You would do some wrist flexion. So you can use a weight. If you don't have a weight, you could always use a bottle of water. You can flip, and wrist extensors working here. In addition, you don't have to use any weight. Then we're gonna go thumbs up, and you're gonna lift. And my little table here is so I can lean into it, and you're gonna go pinky to the ceiling, and you're going to lift up. I like to do 3 sets of 10, 2 sets of 15, or if you can do all 30 in a row, that helps strengthen all of those tendons. In addition to elbow tucked in, nice and easy grip, because we don't want to cause any symptoms or any problems with that carpal tunnel there in the wrist. So easy grip, your hand is just softly gripping the weight, and you're gonna turn the palm down and palm up, palm down and palm up. Because even turning a doorknob becomes painful whenever you have that medial epicondylitis. So I hope this has helped, and have a great day.